Good day. My name is Carolyn Stegman. I'm a consultant with MAC Inc. MAC stands for Maintaining Active Citizens, and it represents senior citizens in all 4 counties of the Lower Shore: Dorchester, Somerset, Worcester, and Wycomico. Now, MAC is your area agency on aging, and it is not a governmental agency. In fact, it's a nonprofit private agency run by a board of directors who are representative of all 4 counties that we serve. Today we're here with Mary Ann Kelly. Mary Ann and I have worked together over a number of years at MAC, starting many years ago with a National Council on Aging grant where we filmed seniors who were receiving Meals on Wheels or who were suffering from financial insecurity. Mary Ann, as a volunteer, has stayed on. I might add, a volunteer extraordinaire. Yeah. And we're very pleased to have her here as she works with the Senior Emergency Loan Program. Welcome, Mary Ann.
Thank you, Carolyn.
The Senior Emergency Loan Program deals with seniors who are facing financial insecurity. Now, if you look at it, many seniors on the Eastern Shore are living almost solely on Social Security or, in fact, solely on Social Security. And sometimes that's not a lot of money. They can usually make it month by month until something happens. They need new tires for the car, the refrigerator busts, or there's a healthcare crisis or whatever. And then that insecurity leads to real hardship. And some of the things that they can't afford during those times are eyeglasses, hearing aids, and teeth. Now, Medicare, who most all seniors have, does cover if they have an emergency situation, a heart attack, or they fall and break their hip. It'll pay for that, hospitalization, for the medications, for the doctor's visits, and then for rehab. But one of the things Medicare does not pay for is eyeglasses, hearing aids, or dental work, which could include repairing of teeth, right down to a cavity fix, to crowns, to dentures. And so if they're in a situation where they can't afford those things that are so important, they come to MAC to secure an emergency loan. So Mary Ann, what attracted you to this program and the Senior Emergency Loan Fund?
Well, taking us back to when we were doing the videos for the National
Council on Aging.
Thank you. Interviewing some of the people we interviewed. You actually interviewed it. I filmed it.
Right.
And do you remember Mr. George?
I surely do.
One of the questions that you had asked him, you had noticed he had no teeth, and they had all been pulled. And you explored that with him. He was very open and forward with it. He said, well, he was having some problems. He went to his dentist. He couldn't afford dental work, and so the recommendation was just pull all of his teeth. Well, you can imagine the nutritional impact that had on him.
Absolutely, yes.
And his health declined. He unfortunately has passed away. But along with that problem, he was living on Social Security. And he spent, I think, most of the money on heating. He lived in a trailer, and quite honestly, it leaked like a sieve, and we were there in winter.
And it was cold.
It was cold.
And so we had to prioritize this money and
Absolutely.
It went to heat during that time. I think, Mary Ann, to me, like you and I take it for granted, the simple aspect of mastication, which is chewing. And there are certain, you pointed it out at one point to me, things like an apple or corn on the cob or a piece of meat or even some vegetables like beans or whatever, unless they're cooked to death, basically, or pureed, these people cannot chew those foods. And so they end up with pureed food, which is often not a large variety of food, and so their nutrition suffers.
Very much so.
And malnutrition leads to one thing, illness. And once a senior becomes ill and ends up in the hospital, it's very hard to stop that downward trajectory.
Very much so.
So one of the things that we know is important is teeth. Well, let's also talk about sight. I mean, I don't care what discount store you go to, glasses are expensive. And if you have the double whammy of cataracts or glaucoma, which many seniors have, then it's even more expensive to get eyeglasses. And so sometimes we see seniors literally in glasses for 5 or even 10 years that they've never changed the lenses, even though we know most should have an eye exam every year or 2 years tops. So what have you seen in that area?
Well, one of the things, if you don't have good vision and you're taking medications,
There you go.
I can squint my eyes and maybe make out, is this one type of drug? Am I taking the right one, the right dosage, at the right time? And if they can't see, unless they've got a caregiver actually helping them, maybe setting them out in certain places.
Right.
But not everyone has that luxury.
And the other thing I've noticed, Marianne, too, is that falls can be such a major problem for older adults. And if they fall, they're going to end up in rehab. They're going to end up, a lot of times, not getting back to baseline. And it's going to impact their future. And if you don't have good vision or good eyeglasses, you're going to miss that step or miss that throw rug or miss that object that's in the middle of the floor and increase your potential to fall and lead to sickness.
Absolutely. One of the things with, and I know you'll probably get to hearing, because that builds on what we're talking about now, is isolation.
Yes, exactly.
And having the experience of, I'm a sandwich generation person. I've got my children, but I also have the older generation. And the isolation that they get if they can't hear, if you're at a Thanksgiving dinner and they have to gum their food, they're very proud, and it's very humiliating. And I'm going to step on your line probably and say, if they don't hear, they can't engage in the community or in the family, and that generation really doesn't want to be a bother. So if you say, how are you doing, Aunt Mabel? Fine.
Right.
She isn't sure really what you asked her, but she knows she's less of a burden if she says, good, good. And you can just imagine how isolating that is.
Or a lot of times you ask them a question and you really get it sort of just a stock, generic answer because they're trying to be friendly and kind, but they really haven't heard what you said, but they don't want to let you know. They don't want to say over and over again, what did you say? And they also don't want to take the risk of people shouting at them or talking very succinctly like I'm doing now, only at a higher tone. It's sometimes very demoralizing. And you cannot have a really meaningful conversation when somebody can't hear.
Well, they get very tired.
Yes.
Not only is it their age, it's tiring to constantly struggle that hard, frustrating because you remember what it was like when you had good hearing, good vision. One of the things that is even far more important than, I think, from the socialization standpoint is if they're in with a doctor and they don't have a caregiver with them.
Right.
Once again, they will say, yes, do you understand, Mrs. Smith? Yes.
Yes.
She may or may not have.
She might not have a clue.
Right. And he'll say, how is your hearing? And she doesn't hear it. My sleeping is fine, is how she may interpret it. So those things, I'm not sure that they always get exactly what they need from a health vantage point because they can't see, they can't hear.
So really, hearing, seeing, and chewing leads into MAC's mission, which is dignity. And you can't have dignity if you can't hear, see, or chew. True. And also independence. So they can start losing their independence to live at home, maybe by themselves, or even to stay in someone's home They become quicker candidates for nursing homes, which we're trying to avoid. And so these factors become very important. Now, let's talk about the senior loan program itself.
Yes.
What is it? Is it a bank?
Well, if it were a bank, we'd have lots of money, I'm sure.
Right, okay.
Actually, it is MAC's endeavor to assist eligible seniors towards the purchase of hearing aids, glasses, or dental needs. It's an interest-free loan.
Okay, so no 5%, 10%, nothing.
No.
Okay.
And what I find so remarkable about this generation is they have pride. They don't want charity. So they work to repay this. Now, mind you, they're very old. And when you consider what even one hearing aid, let alone 2 hearing aids costs, it's $1,000.
Easy.
Easy. They have to balance their heating, their food, their medication, and all other needs. So when they make that loan commitment, they may only pay $5 a month, but they give it every effort.
Right. It doesn't seem like much, but it is very meaningful, and they do want to pay back.
Right.
So the senior emergency loan has so much money in it, and it's restocked basically by people paying their loans from before. That keeps the fund going. What else keeps money in this fund?
Glad you asked. Every year, this is MAC's 16th annual Souls for Seniors Walkathon and fundraiser.
Okay. And that's SOLES, Souls for
Yes.
Seniors. So it has to do with shoes and feet.
It does. For the last few years, we have an indoor 1-mile walk at the mall.
What mall? City of
Salisbury,
Okay.
The center at Salisbury.
Okay.
And they have just been so wonderful and so supportive. The various senior centers and nursing homes transport the seniors to the mall. We have music and entertainment, and there's a fair with exhibitors, health related and otherwise, definitely senior driven. And 2 years ago was my first time, and last year I had the opportunity to film, actually just take shots of the seniors that were coming off the buses. Oh my goodness.
Yeah.
I got to catch my breath. It is so wonderful. So they walk around the mall. We have entertainment, both at the tables, or we have musicians who play, and all the vendors there give a senior discount, so that
That's at the food court.
at the food court.
Okay.
Most of this occurs at the food court.
Okay.
This year we're expanding a little bit. We're going to have a senior art show as part of the fundraising part, and so we're asking everyone to come out to the mall and vote for their favorite art piece created by a senior, and it's $1 a vote. And using that good old Chicago motto, vote often.
Okay.
And certainly fill the coffers for the seniors. Our goal this year is $47,000.
Okay.
And when you consider the price of hearing aids, they can be up to $4,000 for a pair.
Right.
Our Faye Timmons, who runs the program, does a wonderful job in getting a very reasonable price for our seniors.
It's Faye Timmons, who is one of the
A
strong
stalwart
link in the chain of MAC. I mean, without
Absolutely.
Faye Timmons, MAC doesn't run. She's been there many decades, and she is in charge of the senior loan program.
She is.
You can call her at MAC. She has an email. If you write macinc.org, an email, it will be forwarded to Faye, or you can call her at 742-0505 and ask for her.
Correct.
and get the application, and then she will work with you. I know, Marianne, too, that Faye calls around to dentists and tries to help those that might be able to give a special discount for a senior so that we can fix the teeth. I mean, her motto is basically it's better to have your real own teeth in and keep them fixed than to have to tear them out and then put in dentures. A lot of times the dentures never go in and the teeth, they're left toothless. So that's really important.
And she works with all 4 counties.
Mm-hmm.
It's not,
yes, absolutely.
It's just not a Wicomico. Mm-hmm. And we've had great support from our other offices on aging.
Mm-hmm.
And everyone comes. It's a great party. This year's MC is Roger Fallabout from PRMC.
Wonderful.
And we're very excited.
So this brings in money on several levels.
Mm-hmm.
Okay, first of all, people pay an entrance fee to come in, right?
Yes.
And then for that, they get a T-shirt.
Yes.
And it then can partake in the entertainment and all those things.
We do have entertainment. Glad you brought that up. It's the Jones Boys, and they're going to be entertaining. We also have a steel band starting from the minute you get in at 9 o'clock.
Okay.
We'll be serenaded with wonderful music. We have a fair with exhibitors.
Okay.
And our seniors very much enjoy that. This
And
year,
go ahead. I was going to say in the senior art show, will we have a chance to buy those paintings or pictures or whatever they are?
well, we're still working on that. We do have one group who is willing to part with their art,
Okay.
and they're very generous that they will donate a portion of their proceeds to Souls for Seniors.
Wonderful.
We have some other artists who are just showing, and they're all seniors, which is really wonderful. Then we have a photo booth.
Oh, that'll be nice.
If you register for the walk, it's $15. You get a T-shirt, you get a free photograph at the photo booth. And
the shoes. There's
yes,
something with the shoes.
Thank you,
Yes.
thank you. I'm having a senior moment.
Right, we all do.
Oh,
Yes,
gosh.
I know about those.
We have a shoe contest, and it will be live there. All of the centers who have made a shoe will be bringing a shoe. But we also have on MACinc.org the opportunity to vote online for your favorite shoe.
Okay.
And each shoe is identified from the center that it's made. And Lakeside has also selected to enter 2 shoes. So they're going to be a tough competitor
That's
for
going to
this.
be wonderful.
It's $1 a vote, and once again, vote often, vote much, and that money will then go into our goal of $47,000.
Now, aren't there also some organizations who are sponsoring? Tell me about that.
We have some wonderful, generous, loyal sponsors, and they pay for well, actually what they do is they sponsor the event, and to thank them, we put their name on the back of the T-shirt.
Okay.
And apparently, this is my first year actually doing more than just taking pictures. That T-shirt is a much sought-after item among our seniors. And every year those seniors come, and what I understand is the seniors actually have fundraisers in the various centers to pay their entrance fee, and then they wear those T-shirts. So you'll see them walking about in the various towns. So we can always use sponsors.
Okay, and one more time, go over the total who, what, where, when, why, where do they show up, what time, what day of the week, all those factors.
It's September 16th.
Okay, and that is on a
Wednesday.
Wednesday.
It starts at 9 o'clock. We have a balloon arch that has graciously been donated by the mall. They're very good to us, and we very much appreciate their support. The seniors start the march, and walking through the mall is 1 mile. But if you are sponsoring a senior, please feel free to, you can donate online, or you can give, to the senior, $20. That helps the senior towards fundraising. And then they sit around and they enjoy the music. They can have lunch there. They can go through the fair, the exhibitor fair.
Mm-hmm.
They can take advantage of the photo booth.
Mm-hmm.
We also have Sherman
From
the
the
Shorebirds.
Purdue Stadium.
Yes.
Yes, wonderful.
We have a clown,
Mm-hmm.
and we will have some magic,
Mm-hmm.
close-up magic. So we're very excited about it. The art show.
Mm-hmm.
Come vote for your favorite art piece, and we're very eclectic in our art. I understand that a lady who has been making quilts for years is going to display her work.
Mm-hmm.
And so if you love it, help her win first, second, or third prize. And that's basically the day, but it's a lot of fun, and you see an awful lot of shirts.
And it sounds like you've done a lot of planning throughout the year. I know you have.
Well, you know, it's on such a strong foundation.
Mm-hmm.
And this here is an invitation to invite. What we're looking for are superheroes who are going to support the Souls for Seniors. And it's at the food court in the center at Salisbury, September 16th. Now, I know that's a working day for many caregivers and they can't necessarily be there. This year we've gone all out. You can donate online at MACinc.org. Go to the calendar. It'll pop up Souls for Seniors. There's another little pop-up that says votes, and that's for the shoes. Be sure you vote for them. We take a MasterCard and Visa.
Okay.
You can register to walk, or you can just plain donate.
And once again, ladies and gentlemen, that money goes to the Senior Emergency Loan Fund, which is mainly for eyeglasses, for hearing aids, and for dental work. It has been used in the past for other things. I remember one time in a very cold January, a couple came in and their furnace had busted, and they were in cold weather in their house. And we went to the store with them, bought them a space heater, and they took the loan out and paid us back for that emergency loan. So it's something that goes to our seniors throughout the shore, and it really is a worthy cause. So we hope you'll give us serious thought to helping us. MAC always remains grateful for any consideration that you can give us. Mary Ann, let's talk about the loan itself, the Senior Emergency Loan Fund. How does it work?
Well, there's an application, and they can get it at any of the senior centers in the 4 counties. They fill it out. It's certainly not like a bank loan to that detail. And then they will talk with Faye, and she'll work with them. And that's basically how it's handled.
Mary Ann, I'd really like to thank you for being here today and for all the work you're doing as a volunteer for MAC. It's just tremendous, and I wish every organization had people just like you.
Well, MAC is very lucky to have so many dear, dear volunteers, and if anyone hasn't come to look at the MAC building and get a tour, you offer wonderful tours.
Yes.
And so I know that you're always anxious to show off the new building and the new addition. So thank you for letting me play.
Right. And the other thing is that a lot of people say MAC, the Area Agency on Aging. I like to say MAC, your Area Agency on Aging.
Very
because
good.
It belongs to all of us.
It
Thank
really
you.
does. Thank you.
I'd like to thank you for listening, and take care and have a nice day.
Would you like to see your community organization or nonprofit group featured on PAC 14? To get started, contact us at 410-677-5014 or visit our website at www.pac14.org. PAC 14 is a great way to connect with your community.